حضرتك بروف سامعني الصورة واضحة. بروف كيف تمام. الصورة واضحة لكن الصوت شكله ميوت. شكلكم ميوت.
الو.
أيوة أيوة كده الصوت واضح.
أص- اصل الصوت واضح.
كده واضح.
كده خلاص تمام. طيب احسن نبدا. طيب بسم الله الرحمن الرحيم. I would like to welcome you to this yet another lecture on infectious and tropical diseases. The lecture is about microbial infections. And when we talk about microbial infections, we mean bacteria, viruses, fungus, and these are the main attackers of human cells. It's important to always remember that we are actually living in a virtual sea of microbes. Microbes are around us, are within us. We eat them, we breathe them. So it is a world of microbes all over us. And particular surface areas, skin and mucosa from oral to anus, are full of bacteria, which in by and large are the friendly bacteria, what we call the bacteria which is living within us but are protecting us against the pathogens and producing nutrients and boosting the host immunity. So these are the friendly bacteria. If we give antibiotics and we clear these bacteria, diarrhea can occur, pseudo colitis, pseudomembranous colitis can occur because you have eliminated the friendly bacteria. So it's a balance between our life is a balance between eating and getting fat, not eating and getting malnourished, between bacteria which is attacking us, we are resisting the bacteria by host immunity, we are living in harmony with the bacteria which is living within us and friendly. So it's when we talk about infections everywhere and anywhere, there is no tissue which is spared from getting infected by something. Before the antibiotic era, which started by penicillin in 1950, before that there were no antibiotics. And you could imagine that people could die from a streptococcal infection of the throat or pneumococcal infection in the chest. Very simple maladies, which now we don't even look at them as diseases because the response to antibiotics is very rapid. But just imagine before the antibiotics, bacteria used to be devastating, and epidemics have been witnessed just for lack of antibiotics or treatment. Our human life has been greatly uh, structured, profoundly structured by infection and microbacteria. The course of human history has been actually structured by these epidemics. Just to give you an example, Napoleon Bonaparte, who was the emperor of France, when he invaded Russia, he nearly took it over. Has it not been for typhus, which kills thousands of his soldiers, and he has to pull back. Similarly, the colonial power, the white colonial power, when they invaded America and they wanted to take residence of the land, they brought with them a smallpox virus and they distributed the virus among the indigenous population, the Red Indian, and was actually a mass genocide. And then they took over America. So people are really using sometimes the infection and the bacteria. And now we are talking about biological war. It's just like a nuclear weapon. We have biological war, which is bacteria, which can spread very rapidly, killing masses of people, and it is prohibited, of course. But it is there. I mean, if we press hard, certain nations can really disseminate this form of bacteria. Okay, the epidemics which has taken place in the world are always interesting. If we take plague, which is called bubonic plague or bubonic infection, bubo is B-U-B-O, bubo is lymph node. Buboes are lymph nodes. So this is the bubonic plague, as in contrast with pulmonary plague. Okay, this is a ta'un. And the ta'un has really restructured the world. In 1346 to 1353, there was a massive epidemic or pandemic, which started, funny enough, from China, and swept over Asia and then attacked Europe and North Africa. In Europe, one third, 300 million people died from the bubonic plague. And in Asia, it's 500 million people died. That's 50% of the population, and one third of the population in Europe has been died as a result of the plague. So it is obviously if you have that massive killing, then the whole structure of the community is being reinstituted. Plague is interesting because it's been in the Quran, in the Islamic culture as well, and the first notion to plague, I think, came against Bani Israel, and it is in the ayah, which is فَبَدَّلَ الَّذِينَ ظَلَمُوا قَوْلًا غَيْرَ الَّذِي قِيلَ لَهُمْ فأنزلنا على الذين ظلموا رجزا من السماء بما كانوا يفسقون. والرجز in some روايات, and Arwa can support this, that it means الطاعون. والطاعون in history of Islam also during Umar ibn al-Khattab, Sayyidina Umar ibn al-Khattab, the second Khalifa, he went to Palestine, Amus. It's an area which is the headquarters of the Islamic Army, was Amus in Palestine. Now it's wiped out by the Israelis. And he heard that there is a plague in that village or in that city, and he did not go in. متمثلا بقول رسول الله صلى الله عليه وسلم إذا كان هنالك طاعون في منطقة ما فلا تدخلوها ولا يخرج منها أحد. معناته الحجر الصحي, which is quarantine. So this is, but very eminent Sahaba died, Abu Ubaidah ibn Jarrah, Sharhabil ibn Husna, and Yazid ibn Abi Sufyan, and Ma'az ibn Jabal, all died with the plague. So it's the diseases have really changing the geopolitical structure of the human being. Okay, when we come to infection, the story is about immunity. Okay, about immunity. Plague is actually very similar to AIDS because the bacteria, which is called Yersinia pestis, used to be called Pasteurella pestis. Now it is called Yersinia after Alexander Yersin. Is a French scientist who discovered the bacteria 500 years after the plague. 500 years after the epidemic or pandemic of the plague, 500 years. But it is a bacteria which comes from mites, and the mites are rats mites. They live on the skin of the mites, and they suck the blood, and they bring the bacteria, which is a rod-like bacteria, and then when the mites bites human being, they inoculate the bacteria, and the bacteria goes straight to the lymph nodes, attacking the immunity. So in many ways, it's similar to the acquired immunity deficiency, and people die. And because the skin becomes black, it was called Black Death. Black Death. Yersin is a French scientist, as we said, and strange enough, he did not have Nobel Prize. I don't know why, but he's somebody who has discovered not only the bacteria, but also the cycle. He also demonstrated that the rodents, mice and rats, are the one who are reservoirs of the bacteria taken by the mice from the rats to the human. When it becomes pulmonic plague, which that the bacteria went into the lungs, then you can cough out the bacteria and you can infect people that way. But otherwise, it's not by contact, and it is not by mixing anything with the human being. Okay, so it's that is about the bacteria, which is now very rare. It's there is an epidemic about plague, in Central African Republic, in certain parts of Africa, but these are very minor epidemics which can be controlled easily by antibiotics. Okay, the world of microbes with our world as human beings is a fight between existence. The bacteria would like to maintain itself in the world. Okay, man is raising human immunity or humoral immunity and cellular immunity to combat the bacteria. Okay, with the antibiotics, the fight is in favor of human beings because now we can use very strong drugs which can kill the bacteria, and the bacteria cannot be of any significance. However, the bacteria also is being embedded by God's nature to combat the attack by the human beings. What do bacteria do? Number one is they develop resistance to the antibiotics, and now resistance to antibiotics is so important, so significant that there are some nosocomial infections. Nosocomial infections are those infections acquired within the hospital. Some of these bacteria acquired within the hospital, especially ICU, are totally resistant against any antibiotic, and it is a death sentence. If those patients had this type of multiple resistant bacteria, then nothing else can help. It's death. So this is one of the means that the bacteria wants to maintain itself within the world. The second one is emerging bacteria. And if you kill the bacteria, then you will leave the vacuum to be filled by other emerging infections, like viruses. HIV/AIDS was discovered in the 80s, where it was before in animals, and where it didn't attack man. Ebola virus was in the 70s, was discovered as a virus in Uganda and South Sudan. The virus came up, so we have an emerging, the COVID-19 SARS viruses, including COVID-19. Again, these are emerging viruses, which obviously would like to fill in the space where the bacteria has been eliminated. So it is a fight between us and the microbes. Okay, the most important aspect of our fight is we raise immunity against these bacteria. And this immunity is the hallmark of our defense. It's amazing with the number of bacteria, with the virulence of these bacteria, that not every human being is ill with these bacteria. But God's blessing that we had immunity, which is raised, and with the help of floral microbacteria or floral bacteria, then we are in a situation whereby we can, you can balance between the different attacking forces of the microbes. Okay, if we come to the gastrointestinal tract, the infection is common. The infection is very common. The disease is called enteritis, which is inflammation of the small bowel or the bowel. And when attached to it, gastroenteritis becomes a gastroenteritis of children and adults, which is inflammation due to bacteria or viruses, for that matter. Okay, so it is any bacteria which gets in. First, it is being attacked by hydrochloric acid. Okay, it is estimated that if you feed coliform to an animal or to a rat, 99% of the coliform will be killed by hydrochloric acid. This is why people who have hydrochlorhydria, okay, low HCl, due to any disease, even due to proton inhibitors, then we should reduce the hydrochloric acid. There are people with hydrochlorhydria. There are people with pernicious anemia. Okay, people who are using excessive antacids. These will have low hydrochloric acid in the blood, in the stomach, and then bacteria can pass without being killed. So that is one of the reasons why people like those are more prone to infection. So once they get in, they select the intestine, usually the lower small bowel and colon. And colon is a store. It's not a store. It's active store whereby water can be readmitted or reabsorbed inside, and bacteria can live there. Actually, the colon is a bag of bacteria, which is mostly the friendly type of bacteria. So once the bacteria gets in, many of it will get killed by either the immunity, or by the other bacteria feeding or competing with its nutrients and try killing it. So if certain infections like Salmonella typhi bacteria, you really need 100,000 to 100 million bacteria to get over the immunity and the defense of the human being. While others like Shigella, Shigellosis, Shigella dysentery, or Shigella bodiae, these are infections which you don't need a lot of bacteria. So it depends also on the virulence of the bacteria itself, how virulent it is. So it varies from one reason to another. Why do people get bacteria or infection of the gastrointestinal tract? Number one is who you are, why, where you are, and when you had the infection. Okay, who you are, age. Age is an important parameter. So children, are more prone because they are exposed and they don't control their life. Okay, they may be fed by infective food. Maybe flies may just park on the eyes and the mouth, collecting feces, and the child is not has no mentality of hygiene, keeping hygiene. So it's the child is prone to infection, especially gastrointestinal. This is one of the commonest diseases in children is gastroenteritis. And characteristically, it is vomiting, diarrhea and abdominal pain. And the major concern is loss of fluids. So people children, they can come out of the infection, but they can succumb to loss of fluid. The major uh, prognostic indicator is if the child lost fluid or not. So this is due to loss of fluid. It has been noted that after the introduction of ORT, which is the oral replacement therapy, which is a salt, dissolved in water and given to the child to drink, the mortality rate from gastroenteritis has been reduced. Okay, you could argue that the patient is vomiting, have diarrhea. Well, I mean, where is the fluid going to help? No, it is important, even if they are vomiting, between vomiting, you have to try the child hard to give him fluids, oral fluids, and luckily, even in cholera, where the infection is very high, glucose and sodium can be absorbed. So this is the giveaway. If I can give oral therapy, even small as it is, then sodium will be absorbed, glucose will be absorbed, then that's a blessing. Because the major thing is loss of fluid and loss of sodium, obviously, on top of the nutritional status. So who you are is child, then elderly people, who you are is, what is your immunity? Because certain people will have low immunity. And remember that you have congenital, especially in children, congenital low immunity or acquired low immunity. And even malnutrition can give you low immunity. And in a matter of fact, low nutrition, malnutrition makes a child susceptible to infection, particularly gastroenteritis. And on the other side, infection of the gastrointestinal tract will tip the child into a malnutrition. So it's a vicious circle between vomiting, gastroenteritis, and malnutrition. And most people with low status of body, malnourished, especially marasmus or even kwashiorkor, these are subject to gastroenteritis. So the gastroenteritis worsens the condition, and the condition of malnutrition is worsened by the gastroenteritis. So that's who you are. Where you are is definitely, if you are in camps, if you are overcrowded, you have a home, but you have 5, 6 children, mother is not attentive, flies, hygiene, is not very good where you are in a house. And what is when you are there, it is when it is a social economic status of the person and the climate. Okay, we have gastroenteritis mainly in summer, maybe due to the flies. So it is where you are and when did you have the attack. I would like to remind you now and then that these infections are in the majority fecal-oral, from the feces, from the anus to the mouth, fecal-oral. And this is important. This is a fact that cannot be overlooked, because civilization, as I said in earlier lectures, civilization is the distance between a human being and his or her feces. The more you are apart from the feces, you don't mix with the feces, you don't expose yourself to the feces, you don't expose flies to the feces, then you are away from these infections, which are fecal-oral. So it's if you have a siphon, for instance, then the distance is so huge between you and the feces. If you just defecate in the open, okay, you don't have water to wash, you can have the bacteria in your hands. When you walk, you tread on some other pieces of feces and you touch your foot or your leg, then it is all feces and so on. So this is zero distance. So it is important that we keep fecal-oral distance in prevention of these infections. Okay, so hygiene, palatable and potable, safe water is extremely important because many of these infections are contracted by contaminated water. I mean, amoebiasis, shigellosis, salmonellosis can all be contaminated by contaminated water, be drawn and infection occurs by contaminated water. So if you have good hygiene, good sanitation, and adequate clean water, you are more than 80% away from your infection. Okay, so this is important to keep in mind that fecal-oral route is important. This is not only for these bacteria, which cause gastroenteritis, but those for other viruses, okay, rotaviruses, noroviruses, and viral hepatitis viruses A, B, C, not A and E, which are fecal-oral, B and C are parenteral. So these are all bacteria and viruses which will culminate in the infection which we are seeing. Okay, if Arwa there, can we see the first slide, please? Okay. Is it showing? No? It's not showing? Okay. The slide should, yes. That's good. All right. These are the common, I'm trying to collate some of the bacteria of human into one slide of showing it. These are the common pathogenic bacteria of man. The E. coli could be a friendly bacteria, or it could be very aggressive. Could be aggressive. It could produce toxins, enterotoxins. It could be aggravation. It could be apart from toxin, it could be necrotic, causes ulcerations. So the E. coli is a very common infection, a very common bacteria, which often people would think that these are commensals. It is true, it's partly commensals, but it can be extremely aggressive. Okay, salmonella, there are different types of salmonella, as we're going to see in the next slide, and these will cause typhoid fever, enteric fever, salmonellosis. Okay, the Vibrio, obviously, we have two types, the Vibrio, the cholera, and other Vibrios, which will cause diarrhea. Shigella is another bacteria, which is Shigella dysenteriae, bodiae, and these are bacteria, gram-negative bacteria, which cause dysentery. And dysentery is a syndrome, which we'll come to it in description. Okay, Yersinia is there are two types. One is enterocolitico, the Yersinia colitico, and you remember Yersinia is from Yersin, the French scientist who discovered the bacteria in round about 1850. And we have Yersinia pestis, which is the bacteria that causes plague. So two types of Yersinia bacteria. And then we have Cryptosporidium cyclosporin. This is another bacteria which can attack the gastrointestinal tract. Clostridium, we have Clostridium, which appears after the antibiotic therapy, which causes pseudomembranous colitis, and it is called Clostridium difficile. And then we have Campylobacter, Campylobacter, Campylobacter. Okay, this is again another bacteria which is from poultry. So these are some of the bacteria that can attack human being. Okay, if you look into the next slide, okay, this is the dysentery and inflammatory enteritis. Dysentery and inflammatory enteritis. Bacillary dysentery is very common, and it causes blood. The definition of dysentery is diarrhea, tenesmus, and blood in stools. So this is the characteristic, the three characteristics of what we call dysentery. So هذا الابdominal pain. In bacillary dysentery, which is Shigella dysentery, we get what is called tenesmus. Tenesmus is colicky pain with an urge to defecate. It's a colicky pain with an urge to defecate. So if you have a dysentery, you'll have that sense of running to the toilet. Otherwise, you will open it up when you are not prepared. So it's a dysentery is always there is blood. Okay. In cholera, it's usually rice water with very little blood or no blood. So dysentery is very specific. Campylobacterosis, Campylobacter jejuni, amoebic dysentery. Amoebic dysentery is the entamoeba histolytica. Entamoeba histolytica, which causes ulceration, but there are flask-like ulcer, flask-like ulcer, unlike the bacillary dysentery caused by Shigella, which causes superficial ulcers. These are the ulcers in the colon. So this is why you get bleeding. Then you have ciliary dysentery, okay, and then trachinella spiralis, which also give inflammation of the or dysentery-like. The vibriosis, which is Vibrio parahemolyticus, which is different from Vibrio cholerae, which causes the cholera. And then we have salmonellosis. Salmonellosis is Salmonella typhimurium. Salmonella typhimurium may be obtained from bad eggs, and it causes food poisoning, which is called salmonellosis, which is caused by Salmonella typhimurium. It causes toxicity. Typhoid fever is Salmonella typhi. Sometimes we call typhoid fever, enteric fever, or but this is the right terminology. Is typhoid fever is restricted to Salmonella typhi. Enteric fever is restricted to Salmonella enterica, okay, which is different. Paratyphi 1, paratyphi B and C. This will give you enteric fever. Yersinosis, Yersinia, which is these certain rots, which the other type causes plague and this causes diarrhea. Spirella dysentery. Okay, and obviously we have schistosomiasis. If you want to talk about helminths, other helminths, obviously amoebic dysentery is not a bacteria, it is a protozoal. Okay, the bilharzia dysentery is different. This is helminthic infection. But a link between salmonella and schistosomiasis, we highlight it because bacteria of salmonella inhabit the tegmentum. Tegmentum is the mouth of the bilharzial worm, so it keeps itself there and showers bacteria from time to time into the system. So it gives you septicemia of salmonellosis, septicemia due to the harboring of the salmonella in the tegmentum of the bilharzial tegment or bilharzial worm tegment. So it's like a store. So unless you treat the bilharzia in cases of salmonellosis of bilharzia, you cannot get the bacteria to be treated. So it's a lethal combination, which is not very uncommon. Okay, gastroenteritis causes death. Okay, causes death in children, and it is still the single most important cause of death in children. Okay, gastroenteritis due to loss of fluid, And in adults, gastroenteritis is again very common, especially in those people who are less immune. In the war in Vietnam, you remember the American invaded Vietnam, and they had a lot of diseases, particularly gastroenteritis, and it was estimated that soldiers who have gastroenteritis in the hospital are more than any other diseases. Second to it is malaria. And I think because of the diseases in Vietnam, the Vietnamese, the American pulled out. Okay, American pulled out. I think there are two countries where the American pulled out because of pressure. The Vietnam, I think the pressure of the diseases and the pressure of mass killing, that is one. And from Afghanistan, and that is the pressure of the fighters of Afghanistan. In Iraq, again, if you look into the types of diseases, apart from the psychological disease which afflicted the American soldiers, now they are walking on the streets, losing their mind. But gastroenteritis has been one of the major development or major diseases which has affected the soldiers as in Iraq and the Gulf War. Okay, just to remind you about this business of dehydration. Okay, we drink 1.5 liters 1.5 liters a day, okay, depending on the weather, of course. If it is too hot, you may have more or less, but if it is winter, you will have less. So 1.5 liter gets into our gastrointestinal tract by drinking, and this could be drinking just water, fluids, which is by taste of sugar, or tea or coffee. So that's what is important. The second is the body produces fluids from within, and this comes to 8.5 liters. 8.5 liters. And then secretions from the stomach, from the pancreas, and from the bile. These are amounting to 8.5 liters. What appears in the stools, the water, if you just squeeze the stools to get to what is the water or what is the fluid in it, it is not more than 150 ml. So a lot of fluid remains inside for recirculation between the small intestine and the body. So this is important, and it is estimated that 50 liters are being bidirectional between the lumen and the body, back again and in again. So the fluid balance here is important, not only that water, but water and electrolytes. So if you lose these, then you get severe dehydration, you get ill, you get toxic, and you lose your life. So gastroenteritis is the major cause of loss of fluid. And there is a misconception that people who are, on drip therapy or infusion therapy of normal saline, then you are not allowed to give them water. This is a misnomer. People who are dehydrated should have water by all means and by all routes, be it oral or intravenous. So this is the most important aspect of treatment. Okay, obviously you can balance the electrolytes and all the rest of it. But that is important to do. Okay, shall we take in the remaining 15 minutes, we take one disease which is affecting the gastrointestinal tract and giving you fever. And this is typhoid fever or salmonella. And salmonella is caused by Salmonella typhi. Okay, Salmonella typhi. It is fecal-oral. It is still common. It is because of the flies, because of bad hygiene, because of lack of water. People don't wash after defecation, and they allow themselves to eat on the streets fresh vegetables which are not washed, fruits which are not washed. So it is important that you always remember that if you eat outside, it has to be very hot food, okay? If it is fluid, it has to be canned or bottled. This is nearer to healthy water. And then when you are mixing with people, you have always wash your hands. Especially in the tropics, it is important because water is not scarce in many parts, and still we have a lot of flies. So typhoid fever is exclusively human disease. Typhoid fever is exclusively human disease. It is not contracted from any other animals, all right? And even flies, when they pick it from the stools to your mouth, then it is a mechanical transfer of the bacteria. Okay, so the salmonella have 3 antigens, which is, it's a gram-negative. It's a gram-negative motile rod-shaped bacteria. So let us get it clear. This is a gram-negative motile red-shaped bacteria. And it has a flagellum. Flagellum is like a tail, flagellum, okay? This is important because we depend on that antigen in the flagellum for diagnosis. So it has 3 antigens. The somatic antigen, which is the O antigen, the flagellar antigen, which is an capital H antigen, and then the capsular, which is capital V, small I, V or Y capsules. So these 3 antigens are very important in what the test for diagnosis, what we call Vidal test. And Vidal starts with W-I-D-A-L, Vidal test. Okay, the somatic antigen is diagnosis of the present typhoid. If it is a flagellar antigen present, then it is usually of past typhoid, and VI is for carrier. The problem with typhoid fever is the carrier state. When the carrier state is usually Salmonella multiply and is harbored in the gallbladder. So when the bile comes to the intestine, then this is a continuous showering of the bacteria. And the carriers will not show any symptoms. This is why we insist that we get each people who work on the food handling should be examined, not to be carriers. And when we examine them, we examine for capsular or VI antigen. If it is present, then this is an indication for stools culture. We do take stools culture, and if it is Salmonella type, it can be apparent. Okay, so water, milk, food, vegetables, direct contact are all causes of contracting the Salmonella infection. The stomach will do its best to kill the bacteria, but if you have 1 million bacteria going down your tummy or your abdomen or your intestine, then it is something which the body cannot counteract. Okay, where do they go? The bacteria takes the lower part of the small intestine, okay, and then gets penetrating the mucosa and sits in the lymphoid tissues of the intestine, particularly Peyer's patches, P-Y-E-R-S, Peyer's patches, which are at the end of the terminal ileum. And this is important because this Peyer's patch in the lower ileum can be affected, all right, later on in week 3. It can ulcerate, giving you bleeding, or it can even rupture the ileum. And these are emergencies that occurs with typhoid fever. So Peyer's patches are lymphoid tissue which are being taken up the bacilli, they multiply, and incubation period varies up to 60 days, but it can be as short as 3 days, 3 to 60 days, and then the Peyer's patches ruptures into the bloodstream and disseminate the bacteria. Okay, the common symptoms of typhoid, all right, you have to differentiate between symptoms of typhoid as pure disease and symptoms of typhoid which is atypical typhoid. And atypicality is brought about by the use of antibiotics. I will hammer on this, okay? Because nowadays, if somebody has fever, he takes antimalarial and antibiotics. And if it is typhoid fever, even if the antibiotics is partially effective, it gives you a modified atypical typhoid fever. So it is that modification and the use of the irrational use of antibiotics have resulted in resistance, but also has resulted in a change of the clinical picture. Let us see the clinical picture as we used to see it before the mass use of antibiotics. It is a febrile illness, and there is a step-like pattern of fever, okay, with malaise, anorexia, sore throat, dry cough, coated tongue, okay, and constipation. This is in contrast to other infections. Bacillary dysentery is hallmark of the dysentery is diarrhea. In typhoid, you get constipation. And actually, in week 3, when you get diarrhea, then that is bad news, okay? That the patient is getting ill. Leukopenia is very important. And leukopenia, fever with leukopenia, these are typhoid fever, brucellosis, and Kala-Azar. These are the 3 which give you fever and leukopenia. So typhoid is 1. Okay, that is week 1. Second week is the fever goes on. In the first week, despite the fever, there is bradycardia. Okay, that is not the usual. If you have fever, just because of the fever, you can get rapid heart or rapid pulse rate. So it is in second week, this is reversed. Now the pulse will pick up, And during this period of second week, the liver enlarges to 2 centimeters and the spleen enlarges. Here, the spleen is soft. Unlike spleen of bilharzia, for instance, or myeloproliferative disease, which gives you spleen which is hard. Here, this is a spleen of infection. Okay, so it is soft. Okay, the fever continues, and then there is macular rose spots. This is unfortunately cannot be seen in dark people or people with color. We don't call them dark people. We call them people with color, saying that the white people has no color. Okay, so it is people with color. These are raised pink. Okay, what we call rose spots, and they blanch. They blanch by pressure. So it is useful if you have a white person and he gets typhoid, you can see it clearly. Okay, here complication may occur. The complication may be in toxic encephalopathy. People become toxic, and a patient with fever and toxicity is very clear. He feels drowsy, disoriented, and he can even have convulsions. Meningism, is common. Okay, in the third week, if not treated, then complications occurs. As we said, in the pire patches, you can open up, having an ulcer and bleeding, so that is an emergency, or perforation. If it perforates, then it is an emergency of acute intestinal obstruction. Acute intestinal obstruction. Ileus can occur even without bleeding, but these are the major causes of concern. Is you can have bleeding from the pars patches terminal ileum, you can have perforation, and in perforation, obviously, you distribute air in the peritoneum, and you can see it in an X-ray. In a normal X-ray, standing, you can see air under the diaphragm. So this is important. And so this is the normal cause of typhoid fever. But because now we are using antibiotics for no rational use, it's modulating the effect of these diseases. Another example of modulation because of antibiotics is amoebiasis, which is caused by Entamoeba histolytica and causes liver abscess. Early on, when antibiotics are not so florid, people who used to see a lot of amoebiasis, a lot of amoebic liver abscesses. But now everybody is given metronidazole, which is very effective against Entamoeba histolytica. So people who get just abdominal pain, even if it's an irritable bowel syndrome, okay, why don't you take metronidazole? And this metronidazole, if it's an amoebiasis, then it modulates the amoeba. And many people with what is irritable bowel, they take metronidazole for ages, for a long time. Okay. In children, salmonella or typhoid fever can give jaundice. Up to 7% of children can be jaundiced, which is very rare in adults. Okay, so a patient who have fever, stepwise fever, he very soon becomes toxic, encephalopathic, all right, has constipation early on, then he has an abdominal pain, malaise, irritability, convulsions, meningism can all be due to typhoid fever. The diagnosis is straightforward, seeing the bacteria in the blood or bone marrow. If you do blood test or bone marrow culture, then the bacteria can easily be seen. Okay, we don't rely to feces because patients may be carrier. A carrier is asymptomatic, okay, but blood is for sure. Okay, blood may take time for culture, so we use the detection of antigens by antibodies, and these are, we said early, the O antigen, which is somatic antigen, H antigen, which is the flagellar antigen, and VI, okay, antigen. So this is what we call the Vidal test, and there is a titer of Vidal test. If it is that level, it is suspicious, and then you repeat it. If there is a rising titer, then this is typhoid fever. Sometimes from the start, it will be very high titer or titer, and this will be straight away of salmonella. Treatment is antibiotics. You just remember in the 50s, people used to die because of typhoid fever. Nowadays, if you catch them early, they don't die. Very simple. This is science. This is science. We are now in an era where, we can attack the bacteria or the virus in the head. If I understand what enzymes that produces like polymerase, reverse transcriptase, as in HIV, drugs can be made tailored, computerly tailored, okay, and made to attack these enzymes. And if you attack the enzymes, you attack the virus and dies. So this is the no science, the directed science, focused science, which bring health to the human being. The treatment, we used to give chloramphenicol, and chloramphenicol is a drug which is very effective, but unfortunately, in a small number of cases, can produce aplastic anemia, and the aplastic anemia is fatal. So nowadays, we don't recommend chloramphenicol except in eye drops or ear drops. Okay, very effective. But we don't give it systemically because it can cause aplastic anemia. Okay, the drugs which are currently used, depending on the area, because resistance has occurred in many parts of the world. Okay, in our part of the world, Sudan, we used to use co-trimoxazole, which is trimethoprim and sulfur. This is septrin or co-trimoxazole co, and amoxicillin is again very useful, can be used. Quinolone derivatives or fluoroquinolone is another drug which is commonly used in Asia because resistance to amoxicillin and co-trimoxazole has been seen. It is fluoroquinolone. It's an antibiotic, which is all the antibiotics for treatment of typhoid should be given at least for 2 weeks. For 2 weeks. After you finish 10 to 15 days, there is a relapse. Maybe a relapse occurs in 5% of cases. 5% of cases may relapse. And this is then we have to give antibiotics for a long period. Okay, the end result is we wanted to clear the patient. He should not be a carrier, okay, and he should not have a relapse. Okay, unfortunately, if the salmonella hides itself in the gallbladder, multiplies there, then this is one source of being a carrier, And if there are so many carriers in the community, then the infection is persistent. This is why we don't allow carriers to be near food, serving food for population. Okay, so don't be a carrier or do whatever you can to do a carrier, and you can even do a gallbladder removal, cholecystectomy, if you are definite that this is a carrier. Okay, we should observe for relapse, and this can occur in 5 to 7% of cases, and then more treatment is needed to be given for a longer period of time. Okay, luckily the antibiotics are still effective, and the early use of antibiotics in typhoid fever has modulated quite a lot of the pictures. Week 1, week 2, week 3 has been modulated into a case of fever and toxicity, and constipation and headache. So if you have a patient with that, exclude things are common, which is malaria, then white count. If the white count is low, leukopenia, you have then to think about other causes like typhoid fever, brucellosis. These are everywhere because brucellosis is zoonotics in raw milk. Typhoid is everywhere, but Kala-Azar is limited to certain areas. These are the 3 fevers which will give you leukopenia, but Kala-Azar is restricted to certain areas in the world which need to have the fly around for leishmaniasis. So that is give you the broad picture of some of the infections, microbial infections all over. We started on the gastrointestinal one with salmonella. We hope to do others because infection of the gastrointestinal tract is one of the most important killers, not only in adults, but mainly in children. So with that, I would like to thank you very much for being with me. And we look forward for yet another lecture next week. Thank you very much indeed.